Good day everyone, my name is Ole Christian and I'm very excited to present to you today Dignio's solution for follow-up of COVID-19 infected and close contacts. Dignio has created a full virtual health platform connecting patients with clinicians independent of time and place. For the COVID-19 pandemic, we applied our platform to a new use case, namely follow-up of COVID infected and close contacts. This solution will be the topic of today's presentation. COVID-19 has put a lot of extra pressure on already scarce healthcare resources. Our systems have been rigged for in-person consultations, which to a large degree have been transferred to phone calls during the pandemic. Most people who get infected have few and mild symptoms, and most close contacts never get infected. However, we are required to follow them to make sure they stay healthy, as we are no one to lose. This requires a lot of people to spend a lot of time on the phone with healthy individuals. With that, we risk to overlook those who deteriorate and really are in need of help, and we deprioritize other healthcare services. For example, school health services have suffered significantly due to the reallocation of school nurses. Our solution is a virtual clinic that allows infected and close contacts to self-report on their condition, and healthcare personnel to focus only on those who develop more severe disease and are in need of medical attention. Together with the Municipality of Oslo, we have developed a clinically validated questionnaire for infected individuals, as well as a simplified version for close contacts depending on whether or not they experience any symptoms. Let's start with the questionnaire for infected individuals. They are registered in the system by the local response center and download the app on their smartphone. The questionnaire is activated as a task on their profile and they fill this out every other day. The patient opens the task and starts the questionnaire. He or she goes through each question. The different alternatives are assigned a certain score of points. For each question, an explanation is provided where relevant. For example, how to measure respiratory rate, how to register body temperature, or how to register pulse. The total score is calculated automatically, and based on predefined thresholds, the patient is categorized as green, yellow, or red. If green, no action is needed. If yellow or red, healthcare personnel at the response center are notified by an alarm and act according to guidelines. For example, setting up a video consultation directly through the platform. I will also go quickly through the simplified version for close contacts. First, we ask whether or not they have any symptoms. If no, then the task is completed and reappears in 2 days. No action needed from the response center. If yes, they fill in what symptoms they have. The response center is notified and can act accordingly. For example, a PCR test may be warranted. This is what it looks like for healthcare personnel at the response center. Here is a list of all the patients on the solution, sorted by severity of their condition in our triage system. This facilitates prioritization of those who need help most urgently. For each patient, it is possible to assess vital signs and other measurements over time to better inform decisions on how to respond to the patient's condition. We know that resources are scarce and time is of the essence. We can help you implement this virtual clinic in only 5 days, with close support and training by nurses in our customer success team. All 15 districts in Oslo are currently using our platform, with more than 1,500 infected and close contacts that have been followed up so far. The experience from Oslo shows that this virtual clinic improves quality and safety by making sure those who really need it get adequate medical attention. The risk of spreading the virus decreases due to fewer in-person encounters, and this frees up capacity as the resources needed to staff phones, etc. drastically decreases. I hope you found this information useful and that you will join the Dignio room later today to share experiences and ask further questions. Have a great day.